How would you sum up speech pathology in one word?
Siyempre, inisip ko talaga, love. Love siya talaga. It's like profound in the sense that you get to help other people.
Enriching, because being alive is a joy by itself. But being an SP has enriched your lives in more ways that you can imagine.
Commitment. So you are committed to your clients, not only within the session.
Hi, my name is Leah, and I'm an SLP here in Cebu since 2013.
I'm Evelyn De Vera, a speech language pathologist consultant and program director and co-owner at Pangasinan Center for Therapy Services Incorporated.
I am Davilin Avelina Kilantang, a speech pathologist based in Davao.
I've been in the profession for 20 plus years already. Yeah, I basically work with kids in a pediatric setting.
I am Genevieve Roble Quinto. I am a speech language pathologist based here in Cebu.
According to a presentation by Marzan in 2019, in a population of about 101 million in the Philippines, there are about 10 million estimated persons with communication disorders. In the 2019 PASP survey, it was said that almost 60% of SLPs in the Philippines are based in the NCR, while 40% are scattered across the 16 regions of the country. The same study showed that in several regions, there is a huge gap between the number of practicing SLPs and persons with disabilities. This leaves the SLP to patient ratio at approximately 1 to 566 people in the NCR, and at an average of 1 to 8,108 in other regions, according to a study by Ponciano Filiafania in 2018. This number is expected to grow in the coming years as the population ages. Based on the University of the Philippines Manila student profile for the school year 2020 to 2021, 68 BS Speech Pathology undergraduate students listed Metro Manila as their permanent address, while 75 undergraduate students listed their permanent address outside of Metro Manila.
Back then, we were only two, and we can only take as much or as many patients as we can, right? And it was so hard back then to decline. Knowing that you have a full sched, but that's what it is.
Since I came back in 1996, for 5 years I was the only one practicing there. Okay, actually in the whole of Mindanao, I was the only one. You can just imagine the huge demand for our services then, and the frustration also on my part because, much as I wanted to, I wasn't able to cater to those needs.
So far, there are more SLPs working in the province, I think. Although more SLPs are working there compared before, I think majority are still itinerant SLPs. And sometimes the travel time takes its toll on them. I think there is a big number of clients who are still in need of the service, but unfortunately cannot obtain the service because we lack practitioners in the province.
One of the possible ways to bridge the existing gap between practicing SLPs and persons with disabilities in the Philippines is the presence of telemedicine. With the emergence of telerehabilitation as one of its subsets, a study by Leo Chico in 2020 explained how the process of evaluation, therapy, consultation, and monitoring of patients through electronic means have become a service delivery option for many therapists. The said study described how the emergence of telerehabilitation in the midst of the COVID-19 pandemic has allowed rehabilitation services to be delivered remotely from home, the health facility, or in the workplace. This could be seen as an opportunity for SLPs for provinces to provide speech therapy services to patients from their provinces, wherever they may be.
We've noticed that a lot of our kids, a lot of them have been actually improving in terms of different parameters of development, not only in speech and language, but in terms of communication in general. Because I think the number of factors that has brought this about is the fact that the parents have been spending a lot of time with them because of work from home setups also. Despite this pandemic, meron namang magandang outcomes.
Every region has its own particular culture, its own set of languages, its own social practices. What is important to Filipinos in one region can vary in some ways from what is important to those in other regions. What they need and what they value in terms of communication skills may also vary, as may the resources they have available for persons with communication difficulties. According to the data collected by the Philippine Statistics Authority on Population and Housing in 2010, out of the 92 million Filipinos, these are the top languages and dialects in the Philippines, with the top three being Tagalog, Bisaya or Binisaya, and Cebuano.
When I first moved here in Cebu, I did not know how to speak Cebuano, so I mostly spoke with the patients and their families either in Filipino or in English. At that time, I noticed that there was some sort of a wall that made service delivery less efficient than I had hoped for. Cebuanos are very friendly people and they value connection. It's important to them to be able to relate to someone and be comfortable with them at a friend level.
There's that sincerity, the genuine sincerity that you could feel when you're talking to them. As I practice in the province, I realized that it actually enriches my practice as an SLP. It drives me to broaden my horizon, broaden my practice, because I know that families and my clients are counting on me to give them the service and to do the best that I can to help them.
There are still a lot of patients who are in need of SLP services here, and having an SLP who speaks Cebuano will definitely make a big difference. So, para sa mga Bisaya nga SLPs dira pero wala ga practice diri sa Visayas ug sa Mindanao karon, para pod sa mga SLP undergraduate students nga walay plano mo balik diri after mo graduate, nga naman. Bitaw pamalik na mo daghan kay nangita ninyo daghan jud ang nanginanglan diri and dako jud matabang if naa mo diri ga practice.